When Laura Greer got a mammogram last November, the radiologist ordered an immediate biopsy and told her to get a referral to a surgeon.
It was one of the most traumatic parts of it because you knew it wasn't good.
Greer had been due for that mammogram 7 months earlier, but it was delayed by COVID backlogs. Her diagnosis? Stage 4 breast cancer.
Very hard to not be angry at could it have been caught earlier if mammogram had happened when it should have happened.
New figures show that Ontario's breast screening program has performed 422,000 fewer mammograms than expected since the pandemic began. That means as many as 3,000 cases of breast cancer were missed.
So this is the same area.
Doctors are now seeing the impact.
What we're noticing is that women are presenting with bigger cancers and with their lymph nodes being involved. Here is, you see a mass.
Catching cancer at a later stage has consequences for treatment and the chances of survival.
Before that, we would have done surgery and maybe some radiation for it. Now it's surgery, radiation, and maybe chemotherapy.
This is not unique to Ontario. Routine mammograms also dropped off in other provinces, by about 1/3 in British Columbia and Alberta at the start of the pandemic. There's been a similar trend with colon and cervical cancer.
Certainly in my practice, I saw a wave of more advanced cancers that I think were linked to delays in diagnosis.
Ontario's breast screening program is now back to its normal pace.
This is a good time to make an appointment and get your mammogram in.
Laura Greer is responding to treatment.
I go to work full time, I have 2 children, I do all of those things, but you never know when that could change all of a sudden.
Mike Crawley, CBC News, Toronto.